Hello everyone and welcome. Today we are going to talk about sickle cell disease. We will only cover certain aspects about sickle cell disease. Our main goal is to provide you with some information to develop your understanding. And as always, please seek information from your primary care physician. They are licensed and board certified, which means they are professionals who can provide you with answers to any of your questions regarding this condition. Now, let's talk about sickle cell disease. Sickle cell disease has a significant impact on specific populations, particularly those of African, Mediterranean, Middle Eastern, and Indian descent. The global burden of the disease is substantial, especially in regions with high carrier rates. Public health efforts, including newborn screening and genetic counseling, are crucial in managing and reducing the impact of sickle cell disease worldwide. Approximately 300,000 babies are born with sickle cell disease each year globally. On the other hand, 100,000 Americans are living with sickle cell disease. Additionally, 1 in 13 African American babies is born with sickle cell trait, carrying one sickle cell gene but typically not showing symptoms of the disease. Sickle cell disease, SCD, is a group of inherited red blood cell disorders. It is characterized by the presence of an abnormal form of hemoglobin called hemoglobin S, HbS. Normal red blood cells are flexible and round, allowing them to move easily through blood vessels. In people with sickle cell disease, the abnormal hemoglobin causes red blood cells to become rigid, sticky, and shaped like crescent moons or sickles. These sickle-shaped cells can get stuck in small blood vessels, which can slow or block blood flow and oxygen to parts of the body. There are many unique features and symptoms associated with sickle cell disease. Some of those are pain episodes, anemia, infections, delayed growth, and organ damage. Pain episodes happen suddenly and cause severe pain. This pain is derived usually from a blockage of blood flow by sickle cell-shaped cells. The pain can occur anywhere on the body, especially the chest and abdomen. Sickle cells break down early in their life cycle, which causes a shortage of healthy red blood cells. This causes anemia and can be described by fatigue, weakness, and even shortness of breath. Sickle cell disease, or SCD, can make the body more susceptible to infections. Two of the most common infections caused by sickle cell disease are pneumonia and meningitis. SCD affects children because it can sometimes delay growth and development and slow puberty. This occurs because lower levels of oxygen are delivered to tissues. Organ damage occurs when there are chronic blockages. The lungs, spleen, kidneys, liver, and eyes will slowly degrade in function over a period of time. Also, there are 3 different types of sickle cell disease: HBSS, sickle cell anemia, HBSC, and HBSV thalassemia. HBSS, sickle cell anemia, is most common and severe form. Individuals inherit 2 sickle cell genes, one from each parent. HBSC is when individuals inherit 1 sickle cell gene and 1 gene for hemoglobin C. This form tends to be less severe than HBSS. Lastly is HBSV thalassemia, which is when people inherit 1 sickle cell gene and 1 gene for beta thalassemia, another type of abnormal hemoglobin. Sickle cell disease is diagnosed through blood tests. Newborn screening programs in many countries routinely test for SCD at birth. While there is no universal cure for sickle cell disease, treatments focus on managing symptoms and preventing complications. Some treatment may include pain management through medications. You may also be prescribed hydroxyurea, which is a medication that can limit the amount of pain episodes and the need for blood transfusions. Your provider may recommend a bone marrow transplant. This involves replacing the diseased bone marrow with healthy bone marrow from a donor. Lastly, vaccinations and antibiotics can help with preventing certain infections, along with routine checkups with your provider. Now, let's cover the causes of SCD. SCD is an autosomal recessive genetic disorder. To have the disease, a person must inherit 2 sickle cell genes, one from each parent. If an individual inherits only one sickle cell gene and one normal gene, they are a carrier, sickle cell trait, but usually do not show symptoms of the disease. Managing SCD involves regular medical care to monitor for complications, a healthy lifestyle to maintain overall well-being, and support from healthcare providers, family, and communities. Advances in treatment and comprehensive care have improved the quality of life and life expectancy for many people with sickle cell disease. To wrap up this video, let's review a few basic concepts about sickle cell disease, or SCD. SCD is an inherited disorder that affects red blood cells. The red blood cells are malformed due to an abnormal form of hemoglobin S. People with SCD have blood cells that are rigid and shaped like crescent moons. These misshaped blood cells often get lodged in smaller blood vessels around the body, which block blood flow and oxygen to different parts of the body. People with sickle cell disease are more prone to contract certain types of infections, suffer from delayed growth, and may develop organ damage over a long period of time. There are a few different types of sickle cell disease, but the most common type is sickle cell anemia. Diagnosis is usually done through blood tests, and treatment can involve pain management, blood transfusions, and/or bone marrow transplants. If you believe you have sickle cell anemia, then schedule an appointment with your provider. This is the only surefire way to know for sure. The sooner you know, the quicker your provider can develop a treatment plan to manage this condition. I sincerely hope you found this information valuable. Please share this video with someone who may need it. This video was meant to give a broad overview of sickle cell disease. Thanks for joining us to talk about sickle cell disease. This wraps up the video. Please continue to support the channel. Also, please feel free to share your thoughts and comments below. We look forward to seeing you in the next one. Until next time, see you then.